Welcome students. So this is the recall session for biochemistry in INICET May 2023. So I have collected certain questions by recall. I'll be discussing them one by one. Meanwhile, if you have any suggestion regarding the options, you can always suggest. So the number one question, I'll be discussing them one by one. The number one question was on this test. This pictorial picture was shown where the purple color ring was shown. And the history which was given was a child who is having type 1 diabetes is coming with in an unconscious state. The urine was examined and the urine investigation showed this result. So what was this test? The answer is going to be the Rothera's test. Because Rothera's test, you get to have this purple color ring, and type 1 diabetes, you suspect ketoacidosis in when a child is presenting with in unconscious state. You suspect ketoacidosis and you examine the urine for presence or absence of ketone body. So Rothera's test is done to rule in or rule out the ketone body in the urine. And understand it is acetone and acetoacetate which is having the keto group in it gives this Rothera's test positive. The beta hydroxybutyrate, which is also a ketone body, in fact, it is the predominant ketone body, but just because it is not having keto group, it does not give you Rothera's positive. So this picture where purple color ring is shown is the Rothera's test. This test is done taking 5 ml of urine in the test tube, and then ammonium sulfate is added to saturate it so that the protein, if any, is precipitated by salting out method. Then the 2% freshly prepared sodium nitroprusside is added. And after mixing this sodium nitroprusside, from the side of the tube, the ammonia is added. And at the junction of ammonia and the urinary liquid, you get to have this purple color ring, and this is positive Rothera's test. In Benedict test, you do not find any ring. Rather, the whole of the urine color changes either into green, yellow, orange, or red depending upon the amount of reducing sugar in the urine. Fauci's test is done to find out the conjugated bilirubin in the urine, and this is filter paper test where on the filter paper finally as a positive test you get to have leafy color on the filter paper. This for the bile pigment. Biuret test is done to find out the protein, and in that uniformly you get to have light purple color solution as a positive test. Okay, bitter taste of the amino acid was due to. So this will be answered in the physiology. Dr. Kamal will be discussing this question to you because taste buds, different taste buds and their perceptors will be taught to you in physiology. Now coming to the second question, ketone body is not utilized in the liver due to lack of which enzyme? The answer is going to be thiophorese enzyme. This is the enzyme which is otherwise known as succinyl-CoE acetoacetate CoA transferase, which is important to convert the acetoacetate to acetoacetyl-CoA so that it can be utilized. This enzyme is inherently absent in liver, so the liver is the producer of ketone body but not the utilizer of ketone body. When you talk about, so the answer for this question is going to be thiophorese, which otherwise is known as CoA transferase enzyme. Thioesterase is the enzyme which is needed to cleave the fatty acid as a final product from fatty acid synthase complex. Thiolase is the enzyme which is needed for fatty acid beta oxidation as well as for ketone body synthesis. And thiokinase is the enzyme which is there in the TCA cycle, catalyzing the substrate level phosphorylation there. Coming to xanthurenic acid in the urine. So xanthurenic acid is a byproduct in the tryptophan metabolism, and whenever there is vitamin B6 deficiency, in B6 deficiency, the kin-uraninase enzyme does not act. This kin-uraninase enzyme is needed for normal metabolism of tryptophan. So in deficiency of B6, kin-uraninase enzyme does not act, and kin-uranin is converted to xanthurenic acid. So excretion of xanthurenic acid in the urine suggests B6 deficiency, and this is called B6 deficiency index. The next question was highest thermic effect is seen in. The answer is going to be the protein. Thermic effect is nothing but it's a SDA, that is a specific dynamic action. A specific dynamic action, and this is the amount of energy which is utilized to digest, absorb and assimilate a particular dietary component. When we talk about SDA, specific dynamic action of the protein, it is 30%. For the lipid, it is 15%, and for the carbohydrate, it is 5%. So highest thermogenic effect or thermic effect or specific dynamic action is there for the protein. One question was on Pompe disease, which is the glycogen storage disorder type 2. This is due to deficiency of which of the following enzyme? In Pompe disease, there is a deficiency of acid maltase enzyme, which otherwise is lysosomal glucosidase. So in this disorder, lot of lysosome, incompletely degraded lysosome and malformed glycogen are getting stored in the lysosome, and this is due to acid maltase or lysosomal glucosidase deficiency. Pompe disease, you have three varieties. One is infantile onset Pompe disease, another is juvenile onset, and third is adult onset Pompe disease. Low muscle tone and cardiac involvement is the characteristic finding in this Pompe disease. This is type 2 glycogen storage disorder. Due to lack of lysosomal hydrolases glucosidase, the glycogen is not degraded and it gets accumulated in the lysosome. In fact, Pompe disease is the only glycogen storage disorder which is the lysosomal storage disorder. All other glycogen storage disorder, the material is accumulated in the cytosol. Now, what is false regarding collagen? The false regarding collagen is this. Most abundant amino acid is not phenylalanine, rather it is glycine. We have a formula called collagen polypeptide amino acid sequence. The formula goes like this. The glycine XY repeated n number of times. The n is 333 times. So approximately 1000 amino acids are there in the collagen, and every third residue is going to be the glycine. So glycine is the most abundant amino acid in the collagen. And collagen, of course, is a fibrillar protein. We have non-fibrillar type of collagen, but there are many types of collagen which are classified as fibrillar proteins. Vitamin C and copper, they are needed for cross-linking. This is also correct, because for aldol condensation, we need to have vitamin C and copper, because hydroxylation is very, very important for prolyl residues and lysyl residues for such kind of cross-linking. So these statements are correct. Fibrillar protein, vitamin C and copper needed for cross-linking. Hydroxyproline and proline, they are found. This is also true. So the answer for this question, where the false statement regarding collagen is being asked, answer is most abundant amino acid is phenylalanine is the wrong statement. We have seen that most abundant amino acid is glycine. Now there was one question on order to draw the blood sample. This was very important question, because blood collection, when it is done, there is a particular order as per guidelines to collect the blood in different vacutainers. First of all, blood is collected for culture in a sterile vacutainer, followed by citrate tube which is being used. Suppose the patient is wanting PT and APTT coagulation profile is to be done, then the citrate tube is being used in the second order. And then the serum tube, that is a plain red vacutainer, is being used, followed by heparin tube for blood gas analysis, followed by EDTA vacutainer for hemogram and complete blood picture, peripheral smear, ESR, HbA1c assessment. Then finally the oxalate vacutainer is being used. This order is decided to minimize the cross contamination of the tubes. So this you need to remember, and this will be the correct order of collection of blood sample. Then there was a question that when mother is kissing the child, the sweat is found to be salty. Which channel is affected? This is a very classical presentation of cystic fibrosis. And in cystic fibrosis, there is a mutation of CFTR protein. This CFTR protein mutation results in dysfunctional chloride ion channel. So the question was simple in the sense they just asked you which channel is affected, and the answer is chloride channel. Chloride channel in exocrine gland is responsible for secretion of chloride, and so the sodium is also secreted along, and liquid secretion, liquidity is maintained. But in cystic fibrosis, what happens? It is characterized by the thick mucus. This is due to chloride channel dysfunction, so that the sodium chloride is actually not available, water is not available, so mucus is thick. In sweat gland, the chloride channel is responsible for reabsorption of chloride. So in that defect of chloride channel, a lot of chloride is being secreted in the sweat, and that is why sweat is salty. So this is cystic fibrosis, where CFTR gene is affected. One question was on calculation of anion gap. So you have to just use the formula where anion gap is equal to sum total of cations minus sum total of anions, like this. So the value for sodium was given as 145. As per recall, the potassium was 4, chloride was 90, and bicarbonate was 15. So accordingly, when you calculate this, it becomes 105, and sorry, this is 149. So this becomes 44. So there was one option where 44 was given as an option. So that was the correct answer. So anion gap calculation formula you must know, the cation minus anions. Then there was a question on iron deficiency anemia. What is true? So if there is deficiency of iron, the serum iron will be low. Ferritin also will be low, because ferritin is a storage form of iron, that also will be low. Total iron binding capacity will increase, because iron saturation in the transferrin is going to be low, and total iron binding capacity will increase. So this was a multiple answer type of question probably, and so all the 4 options are correct here. The transferrin saturation, transferrin is a protein which carry the iron in the ferric form. That saturation is reduced in iron deficiency due to lack of iron in the circulation. So transferrin saturation is low, iron binding capacity increases, ferritin and iron is low. So all are correct in this given question. It was a multiple answer type of question. Then there was a question on SRY gene. Sex determining region on the Y chromosome is found where? It is on the short arm of Y chromosome. Sex determining region on the Y chromosome is present on the short arm of Y chromosome. So that is the answer here. Sairam, what was the question? Ma'am, high fat meal question. Ma'am, I marked fat quotation is more than 1000 calories. Sairam, I am not getting your question. Please clarify the question. What is the high fat meal means for doing studies question asked. So your question is not getting cleared, Sairam. Please be specific. Now there was one question where the template strand sequence was given in 5 to 3' direction, and then they were asking the mRNA sequence in 5 to 3 direction. For this you have to use the concept. This is double-stranded DNA, and the gene is present in the template strand. So this is the template strand. Gene is always read in 3 to 5 direction, making you RNA in the 5 to 3 direction. This is the basic concept which you have to apply. So in this question, the template direction was given in 5 to 3 direction. It was 5 to 3 direction. It was C, G. This was the sequence in 5 to 3 direction. But as I am telling you, the gene is being read in the 3 to 5 direction. So you convert this sequence into 3 to 5 direction. So the sequence which you will be getting will be A, T, C, A, T, 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 A, T, T, G, C. Now counter to this, when the RNA is produced in 5 to 3 direction, there is antiparallel synthesis of mRNA against the gene. When you talk about mRNA sequence, opposite to A there will be U, opposite to T there will be A, then G, then U, then A, then opposite to A there will be U, opposite to T there will be A, G, opposite will be C, and opposite to C there will be G. So this will be the sequence of mRNA in 5 to 3' direction. So you just don't have to worry about all the sequences and all which are being given to the exam. Just pay attention to the polarity what they are giving and the polarity you need. So basic concept is required, where you must know that template strand is being read in 3 to 5 direction. The gene is being read in 3 to 5 direction during transcription, and the RNA is produced in 5 to 3 direction. So accordingly, whatever sequence is given to you in the 5 to 3 direction, suppose you convert it to 3 to 5 direction, and counter to this, the mRNA will be produced in 5 to 3 direction. So accordingly, you have to answer. Okay, no internet, anion gap bicarbonate was 20. Okay, fine. So if the bicarbonate was 20, you can calculate it accordingly. You have to use the same formula, right? So in my recall, I got it as 15. If it was 20, then 5 more, that is, will be deducted. So it will be 39, right? So depending upon how much was there in the question. So I just complemented and reversed, ma'am. Okay, Sairam, but the best, you have to go stepwise. Otherwise, you may miss the answer. If the template strand sequence is given in one particular direction, make it in 3 to 5, then make the mRNA, right? 35 and 40. Okay, no internet. Now depends. Nearest answer you have to select. If it was 20, then accordingly you have to calculate. All right, just don't worry. Maybe some recall mistake is there. Sairam, your question in fat intake. What is the question in fat intake? What is the high fat meal means? Fat intake was 80% of total food intake. Maybe that you're talking about some ketogenic diet. Well, what was the question? A dry action is studied to the high fat meal given to individual. What does high fat meal mean? Okay. High fat meal, see, normally fat content in a balanced meal is only 10%, not more than that. High fat meals that content of the fat is more, maybe 20-30%. And in ketogenic diet, we give high fat meal to reduce the weight. All right. So coming to the next question, which was regarding this ketone body not utilized in the liver due to lack of which enzyme? I think I've discussed this question. It is thiophorase enzyme. So this was the recall question. Now, if you have any other question, you can ask me. No, balanced diet, fat is not 30 to 40%, Sairam. When we are talking about Indian diet and balanced diet in Indian balanced diet, we have carbohydrate which is around 80%, and we have lipid around 15%, and remains is the protein, 5 to 7%. Right? All right. Any other question from today's exam? If not, then thank you very much and wish you all the best for your result and for further exams. Thank you very much.